Hello and welcome. Today we're going to walk through a gentle daily routine that's all about getting your body ready for surgery and keeping you safe. Think of this as your personal guide to prehab. I know, that might sound like a weird question, but what if we looked at that time before surgery a little differently? Instead of just waiting, what if you saw it as a time for active, empowering preparation? Kind of like an athlete training for a big game. Because really, that's exactly what this is. And there's a name for this kind of training. It's called prehabilitation, or prehab for short. The whole idea is incredibly simple. We're going to use steady, gentle movements to give your body the best possible shot at a smooth surgery and a much stronger recovery. There's no rushing, no pushing yourself too hard. This is all about slow, consistent prep work. Okay, so here's our roadmap. First, we'll talk about the goal, what we're trying to achieve. Then we'll get into fortifying your lungs, building some everyday strength, and tapping into the amazing power of a simple walk. And finally, we'll cover the huge role you play in your own recovery. So let's start with the why. Why are we even doing this? Well, the main goal is right there in the title. It's about preparing your body, giving it the strength it needs not just to get through the procedure safely, but to bounce back stronger on the other side. And this is so crucial to understand. You are an active participant in this whole process. Every little thing you do, no matter how small it feels, is directly helping you get a better outcome. Every deep breath you practice strengthens your lungs. Every single step you take boosts your circulation. It all adds up. All right, let's move on and see how we do this. We're going to start with your lungs because they are, without a doubt, your first line of defense. Keeping them strong and open is one of the most important things you can do to prevent complications after surgery like pneumonia. Okay, our first tool is the incentive spirometer. You'll almost certainly be given one of these at the hospital. Its job is really powerful. It helps you practice taking those deep breaths that keep your lungs fully open and working at their best. And that is a major defense against pneumonia. Using it is pretty straightforward. First, just get comfortable in a chair. Put your lips tightly around the mouthpiece so you get a good seal. Now, just breathe in slowly, as deep as you can, and watch that little marker rise up. Then just breathe out like normal. You'll want to do this for about 10 minutes each day. Next up is an exercise you can do absolutely anywhere, anytime. It's called pursed lip breathing. And the benefit here is pretty amazing for how simple it is. This technique keeps your airways open just a little bit longer, which helps your body's oxygen levels stay nice and stable. And here's how you do it. Just find a nice, calm rhythm. Breathe in gently through your nose for about 2 seconds. Then purse your lips, kind of like you're about to whistle, and breathe out slowly for 4 seconds. The key is making that exhale twice as long as the inhale. Just slow and steady. And our last lung exercise is diaphragm breathing, which you might have heard called belly breathing. This one is all about strengthening your main breathing muscle, your diaphragm, to get it ready for all the work it's got to do during and after surgery. You'll want to put a hand on your belly and really focus on making it rise when you breathe in. Okay, so our lungs are getting stronger. Now, let's talk about building some simple, everyday strength. And listen, this isn't about becoming a bodybuilder. It's about making sure you have the mobility you're going to need after your surgery. First up, the sit to stand. You just find a sturdy chair, plant your feet on the floor, and you slowly stand up and then sit back down with control. You see what we're doing here? We're practicing the exact movement you'll need to do over and over in recovery. It builds that essential leg strength. Try to do about 10 of these. Next up, wall push-ups. Just stand facing a wall, put your hands on it, and gently bend your elbows to bring yourself closer before pushing back. This is so good for your arms and chest. It not only helps with your breathing, but it's really crucial for being able to push yourself up and get out of bed safely. Now, for some step-ups. If you have a stable, low step or stair, just step up with one foot, then the other, and then step back down slowly. The benefit here is huge. This movement is fantastic for boosting circulation all through your body, and that is one of the very best ways to protect yourself from dangerous blood clots. And finally, don't forget to take 5 minutes for some gentle stretching. We're talking simple stuff, shoulder rolls, arm stretches, gentle neck movements. The whole point is just to reduce that stiffness and keep your body feeling loose, which makes everything else, especially walking, so much easier. Okay, now let's talk about what might just be your single most important, most powerful tool in this entire prehab process: a simple daily walk. The goal we're shooting for is a nice, relaxed 10 to 15-minute walk every day. But listen, if that feels like way too much right now, that is perfectly okay. Start with 3 minutes. I'm serious. Just walk around your house. Then maybe tomorrow, try for 4. The key is just to start. So why is walking such a powerhouse? Well, just look at this. It does everything we've been talking about all in one go. It opens up your lungs, it gets your blood flowing, and it is one of the strongest ways we know to prevent both pneumonia and blood clots. The payoff for just a few minutes of walking is absolutely massive. And that brings us right to our last section, your mindset and your role in all of this. And if there's one message I want you to take away, it's this: focus on consistency, not perfection. Here's a great little trick you can use right after your surgery. It's called the pillow hug. When you feel a cough coming on, and you will, just grab a pillow and hug it firmly against your tummy. This gives you support, protects your incision, and lets you get a good, strong cough out to clear your lungs safely and with a lot less pain. And here are 2 more simple but really effective tips. Sleeping with your head propped up on an extra pillow or 2 can make a real difference in how easily you can breathe at night. And it's just common sense. In the days leading up to your surgery, it's a really good idea to avoid big crowds. The last thing you need is to pick up a cold. And this really is what it all boils down to. Please remember this. You don't have to be perfect. You just have to be consistent. A few minutes of calm breathing, a few steady steps around the living room. Every single day matters. Every little bit you do is helping your body get ready. And finally, remember why you're doing this. You're doing it because your body deserves this extra support right now. And because you are so much stronger than you probably realize. With every breath and every step, you are actively giving yourself the very best chance for the safest surgery and the smoothest recovery you can have. You've got this.